Hi everyone, welcome to Bite Size Med, where we talk about quick, bite-sized concepts in basic medical sciences for study and rapid review. This video is on the gas exchange principles in respiration. On inspiration, air moves into the lungs, up to the alveoli, where oxygen enters the capillaries and carbon dioxide diffuses out, which is then expired. The gases move by diffusion between high concentration and low concentration. The molecules of the gas keep moving around and bumping into each other. That creates energy. The molecules impact against the surface and create pressure. The amount of pressure they exert is proportional to the total force of impact of all those molecules hitting the surface at any point. This means that the pressure is proportional to the concentration of gas molecules. The air is a mixture of gases like oxygen and nitrogen, so the rate at which gases diffuse is dependent on the pressure caused by each gas alone. This is the partial pressure of the gas. So for partial pressure, we'll put the letter P next to the gas. Atmospheric air is a mixture of 79% nitrogen and 21% oxygen. At sea level, the pressure is 760 millimeters of mercury. 79% of 760 is 600. And 21% of 760 is 160. So these are the partial pressures of nitrogen and oxygen. The sum of these pressures gives the total pressure, and this is Dalton's law of partial pressures, that the total pressure of the gas is the sum of the individual partial pressures of each gas. In the alveoli, gases stay in their gaseous form. After diffusion into the capillaries, in blood, which is a liquid, they can remain in three forms: as a dissolved gas, as a bound gas where they bind to things like hemoglobin, or as a chemically modified gas, like bicarbonate, which is a chemically modified version of carbon dioxide. The partial pressure in this situation is by the dissolved portion of gas, and not by the other two. So bound gas does not exert a partial pressure. To calculate the concentration of the gas in the solution, we can use Henry's law. That's the concentration of dissolved gas is equal to the partial pressure of the gas into the solubility coefficient. So if we rearrange this equation, the partial pressure is the concentration of the gas over the solubility coefficient. The solubility coefficient for carbon dioxide is higher than for oxygen. So carbon dioxide is 20 times more soluble than oxygen, making its partial pressure lower than that of oxygen. From Fick's law of diffusion, the diffusion of a gas depends upon the difference in pressure, which is a pressure gradient, the cross-sectional area, the solubility of the gas, the distance that the gas has to travel or the thickness of the membrane, and the molecular weight of the gas. Gases move along a partial pressure gradient, from high pressure to low pressure. So the partial pressure of oxygen is higher in the alveoli than in the capillaries, so it diffuses from alveoli to the capillaries. And carbon dioxide is the opposite. It's higher in the capillaries and lower in the alveoli, so it diffuses from the capillary to the alveoli. More the area, more the solubility, more the diffusion. More the thickness, lesser the diffusion, because more the distance that the gas has to travel, like in fibrosis, where there's reduced diffusion. Higher the molecular weight, lower the diffusion. So air travels from the atmosphere, it gets inspired, gets humidified in the respiratory passages, and gets exchanged in the alveoli with the capillaries. The blood that enters the capillaries is mixed venous blood coming from the right heart, and after oxygenation, it reaches the left heart and enters systemic circulation as systemic arterial blood. The carbon dioxide from the venous blood then gets expired. So let's look at the partial pressure of oxygen and carbon dioxide at each step. First is atmospheric air, which has a pressure of 760 millimeters of mercury, and oxygen is 21%. So the partial pressure of oxygen is 21% of 760, which is 160 millimeters of mercury. For practical purposes, that of carbon dioxide is 0. This is the same as the next step, the dry inspiratory air. Now I say dry because it gets humidified in the respiratory passages. Water evaporates, creating a water vapor pressure. At body temperature, this is 47 millimeters of mercury. This dilutes the gases and reduces the partial pressure. So for oxygen, it's 760 minus 47 into 0.21, which gives us a partial pressure of oxygen of 150 millimeters of mercury. And carbon dioxide is still 0. In the alveoli, things change more. Not all the alveolar air gets replaced with the atmospheric air with every breath. It's cyclical, so the concentration of gas in the blood doesn't change suddenly, and there's better control over respiration to maintain blood oxygen and carbon dioxide. Second is there's gas exchange with the capillaries, so oxygen is leaving the alveolus and carbon dioxide is entering. So the oxygen reduces and carbon dioxide increases. The alveolar air is represented with a capital A and the arterial blood with a small a. So the alveolar oxygen is lower than the atmosphere, that's 100, and the alveolar carbon dioxide is higher at 40. The blood that enters the pulmonary capillaries for exchange is from the pulmonary artery, which came from the right heart, which got its blood from the tissues. So it's mixed venous blood. And the tissues have used oxygen and produced carbon dioxide. So the oxygen is lower at 40 and the carbon dioxide is higher at 46. After gas exchange, capillary blood is oxygenated and goes through the pulmonary veins, reaching the left heart and entering systemic circulation. Diffusion is fast and it equilibrates with alveolar air. Therefore, in the capillaries, arterial oxygen is 100 and carbon dioxide is 40. But systemic arterial blood has a slightly lower partial pressure of oxygen, and this is because of physiological shunts. For example, some bronchial venous blood directly drains into the pulmonary vein and reaches the left atrium, so it skipped the right heart, the pulmonary artery, the lungs, and oxygenation, and so it lowered the partial pressure of oxygen in systemic arterial blood. Lastly, the expired air. That's the alveolar air, along with the dead space air, where gas exchange doesn't take place. So it's similar to humidified inspired air. So in alveolar air, oxygen is 100, carbon dioxide is 40, and in the humidified inspired air, oxygen is 150 and carbon dioxide is 0. Expired air is between the two, with an oxygen of around 120 and carbon dioxide of around 27. And those are the principles guiding gas exchange. If this video helped you, give it a thumbs up, share, and subscribe. Thanks for watching, and I'll see you in the next one.